Next, we are going to have a speech from, I don't know, is it Switzerland? Astrid? Yep. Astrid Stückelberger. I can't say the name more nicely, but Astrid, you are welcome. It's okay.
Thank you. Thank you for the picture. I sent it as a joke, but I like it very much. Thank you. AI does nice things sometimes. So thank you for the invitation, Mika, and thank you for taking me as an expert for your case. I'm sure this is going to make a breakthrough. You're the only case I know who has a business, who's attacking a business. And I saw Pfizer in the airport, and it's Swiss, so I feel very compassionate for you. So I'm very proud to be an expert for you. And we discussed the title, and I had this idea that it is about Plato's cave. I don't know if you know, Plato was a philosopher. He was born, 300 before Jesus Christ. He was the pupil of Socrates, and he was the teacher of Aristotle. So this is quite an interesting metaphor. And for those who don't know, and my title was that, when Plato's cave guides public health, shadows on the wall, and replaces solid evidence, it is a basis for science and policy that affects every life and human rights. So it's a big title, but you have to know that in the Republic, Plato wrote it's like that. It's like if you are prisoners in a cave, and all you see is the shadow on the wall of the reality. And those who stay in ignorance are chained in the bottom of the cave. They're looking at the wall and they see only the shadow of a fire where puppets are shown and they only see kind of shadows, and they think this is reality, and they're ignorant. And the whole journey of a hero, like Mika, is that you have to go out of ignorance to go up to the light of the cave. So you have to climb up the cave, and get out of your chains. And once you get out of the chains, then you have the light and you see reality, truth, justice, and much more what they have been hiding to you. So this is a metaphor that I was asked once to make a conference about, and it is very profound, and I think it shows very much what we're living today, is that people are kept in ignorance. Most of the people are afraid to get out of the cave, and the irony is that when you know, we never know everything, that even in science, nobody knows 100% ever. But when you get down to the cave and you want to liberate the prisoners and, of their shadows, you tell them, and they have two solutions. They can deny what you're saying, and they don't believe you, or they can try and get out, and it will take a lot of time. But they can also ridiculize you and say, you're not right, you're censoring you, and even going to kill people because they don't want to hear what you're saying. So we are in this metaphor, and I'm going to just make, there is no timing, so thank you, but I cannot see my timing because I can get carried away. Oh, yes, I see it, okay. So I was going to take just two topics to go beyond PCR test, because my expertise was to show that PCR test is not valid and cannot be used in vivo. It is an in vitro test. But I wanted to make you a rhetoric a bit larger, like Mika asked me, to show you how this ignorance is guiding public policy. So we can say the government is ignorant, but they could also be trapped, and they could be completely forced by a higher power. So there are two aspects, and one is the excess mortality that has been justifying everything, and the case definition, which is not only PCR, but it's how do you test what is happening. And I can talk from a perspective of WHO and the International Health Regulation, where I have worked for 3 years. So WHO has given instruction to the whole world, and it's even said in some text, which is completely wrong. WHO has never given, they give guidelines, but they never can impose anything on any state. So the government is responsible of itself, but many governments can sue the WHO or the United Nations for having made a constraint to them. So how do you say it's a pandemic or an epidemic? You need excess death or excess mortality and excess sick people from the same cause, and that's where the trick is. From the same cause, it is very important. Then once you have the same cause, you have to validate this causality and this contagiosity. And the case definition in that, in what happened in emergency is that they went so fast in the conclusion of a COVID virus, a SARS-CoV-1, that they fooled everybody. They lied and they showed the shadow, and they showed, oh, it's a virus, but actually, you cannot do that in an outbreak where when I was training member states and government with the team of WHO on how do you diagnose case definition of an outbreak, you have to go through Annex 2 of the IHR, the International Health Regulation. You have to see if it is in the list, if what we suspect is in the list, and you have to validate and re-verify each time it crosses the border. And if it's an international concern, public health emergency of international concern, you cannot declare it like a pandemic right away. You have to see that every country has validated that this strain, if it is a virus, is exactly the number of cases in each country, etc. It never happened. It was all a shadow. It was just smoke, and they concluded that we have to lock down and took measures. You see, so when you have an outbreak, it's not just testing one virus. It is first, if it is a virus, you have to go with the core postulate. You have to isolate, purify, take a picture, not the photoshopped picture that you see all the time, and then you have to make the causality in the cells, but also in animal models, and then in human models, and then the contagiosity is the same. It has never been done. 200 institutions have said, we have never found this virus, and it was censored. But what we do normally in WHO, under IHR, is that you look at the symptoms, you look at the clusters, and then you look if it is an infection. But an infection can be caused by many, many things. It can be chemical, it can be allergic, it can be, you have an experience. It's not always a virus. I mean, that was viral, the virophobia was crazy. So it's either infection, either zoonotic, either foodborne, either chemical, either radionuclear, or other. Nothing was done, not once. And once you have symptomatology, a doctor has to be there and make the list. And then if somebody dies, you look if the causality is correct, and you go and look at the autopsy. But it wasn't done. So again, the smoke and the shadow, yes, it's all a virus, and they put this photoshopped virus with spikes, and then they say it's spike protein, and no, it's not at all that. So what they did, they managed to find a tool, the technology, which can be linked to the AI, it's fantastic, the PCR. But it happens that PCR tests are a lab device. They're not a public health device, and they will never be possible to make a diagnostic in a population, in healthy, non-healthy, and the same device for everybody, because it is a lab condition. In a lab, you have to make, the hygiene is highly important, and a PCR can only be tested if you know what you're looking for. In this case, it was not right. And like it was said, the amplification type of cycles were much too high, and even if they were low, they don't even know what they're looking for. So it is not possible. Carrie Mullis, who found this PCR, said that it is impossible to use PCR for a public health diagnosis. You cannot. It is an easy tool. Can you see how the emergency created that they can do it? It was really incredible. So I think that one thing with this, the shadow they have managed to do is that they have transferred the lab to a planetary lab, and everything they say with words from laboratory that are only signals, they transfer to the human in the population at home. And you think, yeah, the PCR said this, and oh, the spike, oh, mRNA is fake. mRNA is epigenetics. So anyway, I will go. That is the first thing, is that the testing, the case definition is wrong, and the symptoms were not taken into account. Autopsy were not taken into the account, and the doctor were taken out. So fake test, shadow test. Also the virus, shadow virus. We still do not know up to today what it is exactly that they are doing, because there's so many causality for so many respiratory syndrome or any other syndrome that people died from, that we have to go up to the light again and come back and try and all discuss together in the light of the truths that exist, many truths. Now, on the scam, the problem is that those statistics that were excess mortality were only number of cases, number of tests, and not number of cases. It was only tests. They don't care if it is positive or negative. They made it up, like they make up excess death or not excess death, and they change the past. So you have to really keep your data, because they are actually changing the past. I have numbers from the past, and I can assure you that in 2020, there was no excess death in the world. No excess death. Professor John Ioannidis from Stanford University has written a paper, and three papers. End of 2020, two, and then one in January 21 in the World Health Bulletin, saying no, there's no excess death in 2020. So no justification for nothing, not even a vaccine pass. The premises are wrong, and there's a cascade of fake and fraud, rolling on in the whole timeline with emergency. So they use the same word today. Up to today, we use COVID. I hear people saying, yes, I got COVID today. In 26. So can you see how they managed to make people stay in this cave, chained to words, to concepts? So 2020, there was no excess death, and in 21, it surged, and it started surging. And I have numbers, I'm not going to read them to you, because it's absolutely horrifying. Even after 6-8 months, there were more deaths than we can say, and more secondary effects in the US, in Europe, with ultravigilance, and we should have stopped the deaths. We should have stopped the data, the research. It's not a research, it was a research. So when we talk now about, for concluding, of the COVID pass, the COVID pass was again a tool of AI technology, like the PCR, to force the rapidity of things, because the problem with technology, it goes so fast that people can't think anymore. So we have to rewire our brain to say that we cannot accept things that are immediate. We have to reassess them. And COVID pass was not justified at all, because the diagnosis was fake, there is no virus, the PCR is wrong, so there is no justification, there's no excess death. So the whole 2020 was really completely based on the ignorance and the fear and emergency that people were living, to impose it on people and abuse their power, abuse their human rights. And by the way, they violated all their instruments, international instruments. WHO violated the constitution of respecting people, the international health regulation, all the human rights articles, and Article 43, which says that you cannot take measures without having a rationality and a scientific evidence. And there is absolutely no evidence for having imposed an experimental vaccine, thus a COVID pass. So in that way, if we want to conclude, so I think you have a big subject, because you're actually taking the whole chain of reaction, and you can at each step, like it was done now, by the speakers, is that you can each step find a fraud, a fake, and think that they have concluded and left people back, rolling down into the cave in ignorance. And what we can do now is that I will just quote Søren Kierkegaard, the philosopher from Denmark, who says there are two ways to be fooled. First, to believe what is not true, which means lies, deception, ignorance, or to refuse to believe what is true. So you can deny, or you can refuse to believe what is true is denial. So this is inconvenient truth, and it is very difficult to convince people, even governments and even tribunals, because they are coerced. But also, maybe in their brain, they don't understand. They're down in the cave. So we need to find an ability to see this illusion and lies for other people, to see beyond. And I think lawsuits can fight media and TV who are, enhancing this ignorance. But comes to out of the cave, we cannot just go out of the cave. We have to also have science and policy with ethics and with consciousness. Otherwise, it's the ruin of the soul and the ruin of humanity. So thank you, Mika, for doing what you're doing. And good luck. We are with you.
Wow, that was powerful. Thank you so much.